Acyclovir mechanism of action, clinical applications, and considerations. Acyclovir is a potent antiviral medication primarily used to treat infections caused by the herpes simplex virus type 1 HSV-1, herpes simplex virus type 2 HSV-2, and varicella zoster virus VZV. Its widespread use stems from its effectiveness in combating these viral infections. Mechanism of action. Acyclovir is a guanine nucleoside analog, essentially a synthetic version of a building block for DNA. Its mechanism of action hinges on its conversion into the active form, acyclovir triphosphate, within infected cells. This process involves several steps. Antiviral activity. Antiviral activity. Acyclovir exhibits the most potent antiviral activity against HSV-1 and HSV-2, followed by VZV. Its effectiveness against CMV cytomegalovirus is significantly weaker. Clinical studies have shown that CMV infections are not effectively treated with acyclovir. The antiviral activity against Epstein-Barr virus EBV is also limited, with no specific research available on this aspect. Antiviral activity. Important note: certain drug-resistant strains of HSV and latent HSV residing in ganglia may not be eliminated by acyclovir therapy. Clinical applications. Acyclovir has been effectively employed in the treatment of various herpes viral infections, including herpes simplex skin infections. Acyclovir demonstrates significant efficacy in managing HSV-1 and HSV-2 skin infections, encompassing both oral and genital herpes. Clinical applications. Herpes simplex encephalitis. Acyclovir is highly effective in treating severe HSV-1 encephalitis, potentially reducing the mortality rate from 70 to 20. It can also mitigate the severity of associated complications in those who recover. Clinical applications. Herpes simplex meningoencephalitis. Acyclovir is also a viable treatment option for milder forms of HSV-2 meningoencephalitis. Varicella chickenpox. Acyclovir can be used to manage chickenpox, especially in individuals with a heightened risk of complications. Clinical applications. Shingles. Herpes zoster. Acyclovir can reduce the duration of vesicle development, alleviate pain, and shorten the recovery time when used to treat shingles. Pharmacokinetics. Bioavailability. Acyclovir's oral bioavailability is approximately 20, ranging from 15 to 30. Food intake does not significantly impact the absorption process. Pharmacokinetics. Distribution. Acyclovir is widely distributed throughout bodily fluids and organs, including mucosal membranes, uterus, aqueous humor, vaginal fluid, semen, brain, cerebrospinal fluid, kidneys, muscles, tears, liver, lungs, intestines, and spleen. Pharmacokinetics. Elimination. Acyclovir is primarily eliminated from the body via urine. Considerations. Adverse effects. Acyclovir can lead to adverse effects such as nausea, vomiting, diarrhea, headache, dizziness, fatigue, skin rash, itching, and joint pain. Pregnancy and lactation. Acyclovir is not recommended during pregnancy or lactation unless the potential benefits outweigh the risks. Considerations. Drug interactions. Acyclovir may interact with certain other medications. Dosage and administration. Acyclovir should only be used as prescribed by a healthcare professional. Conclusion. Acyclovir remains a valuable antiviral drug for treating numerous herpes virus-induced infections. However, its potential side effects, drug interactions, and the need for appropriate dosage should be considered. Consulting a healthcare professional is crucial to ensure safe and effective treatment with acyclovir.